Hi, well, my name's Natalie Weiss. I'm a resident at the Mayo Clinic, and today we'll be talking a little bit about orbital lymphangioma and how we can treat that, and an interesting use of a new agent that hasn't been used in this particular way before. My residency is in otolaryngology, head and neck surgery, so this is sort of a surgical discussion, but I think that the new applications and knowledge of the things that we use in surgery is so relevant to medical practice, and having multidisciplinary interaction is such a vital part of the continuity of care for all of our patients. So hopefully you will find this relevant to you regardless of your future or current specialty. The learning objectives for this today are to talk about orbital lymphangioma, its clinical presentation and challenges with management, to talk about fibrin glue in the management of orbital lymphangioma and some of the challenges with that, and then to talk about those multidisciplinary approaches to orbital lymphangioma treatment. So in a nutshell, orbital lymphangioma lymphangioma is a benign congenital vascular malformation. It can appear in just about any place, but it commonly occurs in the head and neck. It uncommonly occurs around the orbit. And this, while other locations may not be of any urgency to treat, the orbital lymphangiomas can be very urgent because they threaten vision loss within a short period of time. So we approach these with relatively aggressive treatment. The treatment generally is surgical removal, but this can be pretty difficult because lymphangiomas are these vascular lesions. They've got a friable capsule, so they can't really be scooped out in the way that a solid tumor would be scooped out. In general, we'll debulk, so remove as much of the lesion as we can, and then decompress the orbit. And there are a couple of ways that we can do this debulking and decompression, and even this requires multidisciplinary approaches. So we've got our head and neck surgeons, our ENT doctors, and then we've also got our eye doctors, our ophthalmologists, who come in and approach from a transconjunctival direction. As far as other treatments for orbital lympangioma, there really isn't any gold standard, but there have been people who kind of approach with observation, sclerotherapy, systemic therapy with sirolimus, or this surgical excision. But recently, people have been using fibrin glue as either a monotherapy or as an adjunct, and I'd like to talk with you today about the possibilities for that. So to do that, I want to talk with you about this patient. She was a 55-year-old who had many, many years of knowing that she had this congenital vascular malformation, but it had only recently started to cause her some really severe proptosis and some double vision. So you can see this picture on the right here. She's got a pretty obvious deformity, and you can imagine how this is affecting her daily life. Her family was getting very worried about her. She was living kind of in the middle of nowhere. She was from another country. She had a lot of barriers to presenting to our office, but was under kind of that observation plus systemic therapy window, and it was not working anymore. So she came to us at the Mayo Clinic, and we did a debulking and decompression through both transnasal and transconjunctival approaches. Transnasally, we went in, and if you haven't seen an endoscopic view of the inside of the nose, this bottom image is sort of what it looks like. We go in and go to the lamina propria, the really thin bone that is the lining between the orbit and the nasal cavity, and we cut through it, let the periorbital contents kind of prolapse into the nasal cavity. And in this case, in the case of an orbital lymphangioma, we identified all of the areas that we could see that had involvement, which in this case was primarily along the uncinate process of the ethmoid, and injected some fibrin glue into the area to try and solidify it. We found sort of the biggest area of effect and injected the fibrin glue, and were able to get quite a big amount of the vascular malformation out. Then our ophthalmology colleagues came in and transconjunctivally decompressed the orbit down into the maxillary sinus. So basically, if you can see my pointer here, we cut through the bottom of the bone at the bottom of the eye, just leaving that infraorbital nerve intact, and then let the eye contents prolapse down and then inward into the nasal cavity. So she had a lot less pressure on those important structures at the back of the eye. Unfortunately, in the transconjunctival portion, you can see there's this little area right in the medial lower eyelid that has some involvement, and it could not be aspirated, so we couldn't use fibrin glue in this area. And I should say fibrin glue has been used transcutaneously through the skin in other studies with some good effect, but this is the first time that anyone has ever reported on injecting through the nasal cavity. So what do we know? We know that fibrin glue is a really interesting FDA-approved intervention. We've used it many, many, many years for hemostasis, as an adhesive, and as a targeted delivery system for certain medications. However, we now know that it can be used to gelatinize these lymphangioma lesions. It sort of makes sense because there's blood within these lesions, and it's something that gelatinizes. It causes clotting, essentially. So it makes sense that the vascular lesions can also be kind of lumped off. And in these cases, it assists in dissecting out those pieces of the lymphangioma, improves functional outcomes, and reduces rates of recurrence. This particular patient looks very, very much better. This is at her first post-op visit, which was only 2 weeks after surgery. So if you can imagine, going from having terrible vision loss to a significantly improved appearance, a practically normal appearance, and having much better use of the eye, then it's a really awesome outcome for her and for her family. This particular patient had an orbital lymphangioma that was characterized more by this sort of diffuse, everywhere involved infiltration rather than one little cystic lesion. So it's imaginable that somebody with a discrete cystic lesion would respond a little bit better to using this fibrin glue. But we used it in the largest involved region, and as I mentioned, she had a fairly favorable outcome. She has still had a little bit of that double vision, but it seems like it's gradually improved over the last few months. So as far as closing thoughts, orbital lymphangioma is something that needs to be treated very aggressively. It should be something that you're thinking of if someone presents with this proptosis, loss of vision, and know to send to a specialist because it needs to be debulked and decompressed so that they don't permanently lose their vision. Excision is fairly complicated and difficult because it can be diffuse, it's very thin-walled lesion, and it can bleed a lot if it isn't coagulated. There's really no gold standard of treatment, so fibrin glue can be used as an adjunct and safely injected transnasally, we know now from this case. And that is something that could definitely be put into future action for future study. And there's often a need for combined transnasal and transconjunctival approach to debulking and orbital decompression.